president said 65 years ago, Nigeria's healthcare system was small and heavily concentrated in urban areas. Today, facilities and personnel have multiplied with federal, state, and private hospitals scattered across the nation. Now, despite this, citizens continue to lose faith in our system. Underfunding, crumbling infrastructure, and a mass exodus of medical professionals to other countries have weakened healthcare delivery. Medical tourism drains billions annually as Nigerians seek better treatment abroad. Analysts say that while access has grown, trust and quality have steadily declined, leaving the nation's health sector in a crisis at 65. Why do Nigerians continue to distrust local hospitals despite the growth of healthcare infrastructure? Why do you think the Nigerian people, many people have completely lost faith? Okay, I don't know if you heard about the journalist that died, and when her boss was talking about, how he thinks she would have been saved if our medical practitioners are more proactive. We've had cases of, someone getting to the hospital and being told you must pay money first. Even though we have grown, we now have these hospitals scattered everywhere. Why do you think Nigerians still distrust the system?
When people do, especially Nigerians, when people do something or render a service, do a business solely because of the money.
Right.
You see that what they will be giving out will not be good enough. So Nigerians believe that our hospitals don't care about their lives. They don't care about their health. That's why anybody that has money travel. It doesn't mean that we don't trust that they can deliver, even though we have a lot of them that cannot deliver. A lot of people have died because of incompetence. Some of them are not good. But we have a lot of them that are good.
When we say some people are not good, were they trained in Nigeria for this practice?
Yes.
And
that's how it is in every country.
These same people that are not good, are they the same people that are part of the people exodusing to other civilized nations and making it there?
No, those people that are not good, they cannot travel because they know that the system there is strict. It's only those that are good, that have ideas, that have skills in what they have studied, that want to travel. And they are traveling, they are leaving the country because they believe that the country doesn't want them to grow. The system is not there for them to flourish. That's why they are leaving. So the ones that are not good, now this brain drain, why is it that the countries that are causing this brain drain, they are not tapping everybody? It's not everybody they are collecting. They are collecting the ones that are good and leaving the rest for us. Now, when they get there, you begin to see that these people are good. And our system, our education system, in terms of health, I believe the education, our universities are trying in the field of health. We have to acknowledge that. Because they have been training, they have been churning out good doctors. That means they are doing something good. They are doing it right. So we want them to replicate that in every other field, so that everybody can be well skilled, well equipped with the right knowledge.
Right. Now we talked about brain drain. How serious do you think this impact of brain drain has been with doctors and nurses living in Nigeria, especially on our healthcare delivery? When you look at it, someone goes to the hospital, you have maybe 2 doctors attending to maybe 40 different people.
Yeah.
How impactful has this brain drain been to our healthcare systems?
Now, I don't really believe that we have short of doctors.
Some hospitals have come out. Some hospitals have even gone on strike because they need more personnel. So we actually do have that problem going on.
Now, some people, you can see that some people that studied medicine, I know some people that studied medicine that don't want to practice medicine. They left the field entirely. And just as it is in every other, but this is a critical area that if you know that it's not your calling, it's not your you don't have the zeal to be there, don't go there. When we train you, when we finish training you, you should be able to go there and save lives. And so now, some people that are leaving need to be discouraged from leaving.
How do you discourage people from leaving?
Now, how do we discourage them? By giving them, now, what do you want? Just like these people that are the lecturers that are going on strike, there is something they have been trying to achieve. There is something they have been telling you to give to them. Why can't we give it to them and see what happens? They are clamoring for good infrastructure, the payment of arrears, all the rest of them. Why can't we give it to them and see, and now give them, give them a lofty, a big goal to achieve? I want you to do this within 10 years. I want you to do this within 20 years. I want you to produce people that can do this, can do that within this number of years. You see that everybody will be, will be motivated to work.
Right. Thank you so much. So now, what reforms could restore confidence and reduce the billions spent yearly on medical tourism? Someone has an accident, and when this person, is involved in the accident, the family, everybody's grappling around looking for money to send the person to what country? India. Or they're looking for a way to send. How do we improve our systems? Now, you've talked about, giving them what they want, but Nigeria is a borrowing state. When we say, most of the time, we're always, borrowing from one country or the other to fund infrastructure, and there's usually no money, as is described. We're trying to pay back some loans, all the things that the government has going on. But for whenever a government official is sick, it's quick to get to the UK. Whenever there is headache, it's quick to get to the UK. That is not exactly the reality for all Nigerians, but for, the upper class Nigerians and some people a little bit. Right now, the inflation has made us, barely see the middle class people. But
everybody now.
Inflation has made it a little difficult to see the middle class people. But you find out that even the people that do not have, come online to solicit, please, we need funding to send so person to India for treatment. What can we do to reduce this exodus of people spending billions of dollars abroad? Because of course you're not going to spend naira when you go, so they're spending millions of naira and millions of dollars and billions of naira abroad. How do you think we can bridge this gap?
Well, the people that are supposed to do that are the ones traveling abroad. Are you getting it? The people that are supposed to do something to make sure that nobody travels outside the country for treatment, for other things, for rest, to eat corn or to eat yam, something like that. They are the ones doing it. They are the ones committing it.
Now, let me take you back a little bit to what we just finished talking about. We've said that many Nigerians, according to you, the very great minds are the ones that are being drained from the Nigerian system. Yes. Now, do you think that there is a high possibility that when these people that go abroad to still spend money to treat themselves are actually still being treated by the majority of Nigerians?
Yes, that's the truth.
So why can't we keep this money within the economy?
No, the problem of Nigeria is multifaceted. The reason why people are leaving is numerous. We have a lot of reasons why people are leaving. People are leaving the country because of insecurity. People are leaving the country because of the way the economy.
But is it insecurity now? I do agree with you, but insecurity is not a reason for me to go abroad for medical care.
We were talking about generally people that are leaving.
No, I was talking about people that leave Nigeria for medical treatment abroad.
And yes, the best thing we can do is to invest in our health sector. Is to create is to bring in the right infrastructure and to pay them well. If you pay them more than what they are paying in Canada, in UK, and Australia,
can Nigeria afford it?
Nigeria can afford it. If Nigeria has money, I believe that Nigeria.
You believe that Nigeria has money, but you do know that we borrow.
Now, this is Africa.
Okay.
if you are talking about if you talk about Africa, the African economy now, Nigeria is number 1 and number 2. So what can't Nigeria use is a financial strength, the economic strength,
Right.
to help itself, to power every sector. They have the money. The money that they waste during elections, only during elections. They're not talking about other monies which they spend when they go out, travel outside the country.
Right.
Only the money they spend during elections is not enough. The one they will just give one person, one structure to deliver. Is it not enough to make Nigeria a better place? Then you talk about other things. Nigeria has enough money to make sure that everything is working for the betterment of Nigerians.
Right.
But the people that are supposed to do it, I don't know, the way they, and everybody has a way of leading. Everybody has a way of
The leadership style.
Everybody has his own leadership style.
Right.
I don't know whether it's their leadership style. They should change their leadership style. The way they are, or their worldview, or their values, the way they see running an economy, or the way they see running a business. They should change and make things better, put the right things in place so that Nigeria can move forward. Nigeria is not really moving, even though we have made some progress. Nigeria is not really moving forward. This is not where we are supposed to be.
Right.
That is the truth.